obviously looks a little bit different. We've got 3 openings here instead of the urethra and the rectum. And we're going to start out with the gonads, the ovary. Those are internal within the pelvis rather than external in the scrotum. And we're going to look at development film again for the female, or your genital development. But the egg is released from the gonad, from the ovary, captured by these finger-like structures of the oviduct, transported by the moving cilia of the oviduct through the uterine tube, same thing, oviduct and uterine tube, and it passes into the uterus. So this is a very muscular organ, the uterus. It bulges into the vagina, and that opens into the vestibule. All right. So we just talked about the external urethral sphincter, urogenital diaphragm. So in the female, that's this muscle right here. So we have the same muscle, and there are vestibular, greater vestibular gland, or global urethral gland. Same thing in the same name. And then here would be the erectile tissue. And on either side of the urethra, we have these paraurethral glands, or skein glands. We'll talk about those on Tuesday next week. In 2003, they were officially declared the homologous structure or equivalent structure of the prostate gland. Remember how the prostate gland surrounded the urethra? All right, so those are, some women talk about having ejaculation when they reach orgasm. And everybody said, oh, that's just urine coming out. And you test it and it's not acidic. And so it's thought to be secretions from these paraurethral glands passing through the urethra, because we have no glandular components secreting into the vagina. The bulbourethral glands secrete just into this vestibule space. Kind of a background on what we're going to be going over. We're going to be talking about ligamentous structures that support the ovaries and the uterus. You might remember from Bio431 when you learned membranes, we have the 3 P's: pericardium, pleura, peritoneum. All right, so here's the parietal peritoneum, and it doesn't completely surround the bladder, just kind of drapes over the top, more so if the bladder is full. Drapes over about 2/3 of the uterus and part of the rectum. So that's what separates a peritoneal cavity from pelvis. In the thoracic to abdominal, we have the diaphragm muscle. We have no muscle here. We just have the peritoneum. And when we talk about some of these ligaments, it's the peritoneum that we're going to be using as part of the ligaments. Question, Dickie?
Yeah, the peritoneum where the ovaries go, goes over the cervix. So the
cervix
ovaries,
is here.
The fallopian tubes actually go through the peritoneum?
I'll diagram that in a few minutes. That it actually wraps around them like my sleeve, and then hangs down to create a ligament or a mesentery.
Oh.
So we look at our. Somebody smoking out there? Fire?
It smells like something's on fire.
Yeah, I smell like the air in this room comes from the opposite end of the building, so someone is sitting outside the opposite end near micro, where if they smoke out there or something, it comes back in here. So wherever it's coming from, it's on that end. Yes. So here's our undifferentiated embryo, fetus, and remember the homologous structures component. So if we talk about in the male, it was the mesonephric duct that developed into the efferent ductules and epididymis and vas deferens. The homologous structure in the female, mesonephric duct will disappear, and paramesonephric duct is going to be the structure that develops into the oviduct, which then fuses to form the uterus. You can sometimes find remnants of the degenerated mesonephric duct in the female, and in fact, one of the models back here, I'll bring up to the front of the room, carrying structures are the ovaries. Here's the oviduct, and here would be the mesonephric duct and efferent ductules that were left behind in the membrane ligaments of that structure. So let's take a look at that film again. This time for female.
Can you turn one of the lights off, please?
Yeah.
Thank you.
So the first part's going to look very similar as we see the mesonephric duct and pronephros disappearing and the mesonephros appearing. And again, if you want to visualize this, it's under your female, your genital development. So down from the top of the screen will be the gonad, which in this case will be the ovaries, and the true kidney and your turgid near the bladder. And now come the ovaries up at the top of the screen, and the blue is the paramesonephric duct.
So the kidney's going up, right?
So the mesonephric kidney is disappearing as the true kidney develops. And where the paramesonephric tubes join, we're seeing the formation of the uterus. These descend from the posterior abdominal wall down into the pelvis and move laterally and posteriorly. Yes. They fuse to form the uterus and the top third of the vagina, all developed from the paramesonephric duct. But again, no direct connection between the ovary and the oviduct. Once the egg is released, it has to be captured by the oviduct. It's not going to necessarily always be in that region. So let's go back to this slide here. So here is the oviduct or fallopian tube fusing to form the uterus and cervix, and then just the top third or so of the vagina. The rest of it comes from the same structures that form the urinary bladder.
So the fimbriae are also paramesonephric?
Yes. All right, so if we look at this structure, here's a different stage. This is male and this is female. So as you go through, here's the glans penis that we just described, and then next week we'll describe the similar formation of the glans clitoris. So those would be homologous structures. Again, I'll review this with you next week. But glans penis is homologous to glans clitoris. In the female, which remember is what the male develops into appearing like if the SRY gene is not expressed, we have the inner lips, the labia minora, which we will talk about on Tuesday. Those are the thin lips that don't have hair follicles that form the wall around the opening of the urethra and the vagina. In the male, those wrap around and fuse to form the shaft of the penis. So even though we haven't talked about the labia minora yet, I'll write it up here. They enclose the urethra, and that's labia minora, or the small thin lips. And then the labia majora in the female are the thicker, fleshier ones that have the hair follicles on them. And they fuse to form the scrotum. So the penis doesn't have hair follicles typically, the scrotum does. All right? So we have scrotum. And labia major. In fact, let me switch files here and go back to the male slide. You can see this seam line right here along the shaft. That's due to the fusion of the labia minora, and then onto the surface of the scrotum, and that's due to fusion of the labia majora. So if you have access to a male, take a look at that. Of course, if you are male, you can just take a look at that yourself. If you have an infant, you can see it on the infants. If they're older than a year and a half or so, they're not yours. Even if they're a baby, I would ask permission. And then as a parent, obviously, depends. I always feel uncomfortable with a 3 or 4 or 5-year-old saying, "I need to look at you." If you're changing diapers or something like that, you can visualize this seam line that comes from the fusion of those structures that otherwise would be separated. We talked about, I told you about that island in the Caribbean. Did I tell you about that? I guess I told the morning class. When I first started teaching, I had available a film, and it was actually on a film reel, okay, not videos. How long ago I started teaching? In 1981. That show, it was discussing some of the causes or influences of homosexuality in males, and was looking at the effects of sufficient testosterone exposure for the male fetal brain. And one of the places they went to was an unidentified island in the Caribbean, where because of its isolation, there had been inbreeding and some mutations, so that the gene, which takes the testosterone and converts it to dihydrotestosterone, known as DHT. That's what's used for these secondary sex characteristic developments. And without enough of that enzyme, there was insufficient amounts for the male babies to be born with these changes occurring. And so they looked like they had a clitoris and they had the labia minora and majora. And it wasn't until they reached puberty at around 11 or 12, a little earlier, that this fusion actually occurred. And the labia minora became the shaft of the penis, and the labia majora fused to form a scrotum at 10, 11, 12. And it wasn't uncommon. It wasn't, oh my goodness, what's happening here? It was just, okay, I have a girl, maybe, maybe not. Kind of a thing. But that normally would occur, obviously, during fetal development. So let's switch back to female here.
I hope she talks about hermaphrodites. I'm just curious.
Okay, so when you talk about, it used to be called a hermaphrodite, true or false, and now there's a whole range of, intersex is the more common term. It's pretty rare to have a person with a testis and an ovary, half the cells in the body XX and half the cells in the body XY. It's usually some non-expression of hormone, so that they have XY but look male, or have have XY but look female, or have XX and look male, but that's more rare. That usually is a tumor of the adrenal gland producing androgens or male hormones. But there can be a variation. We have friends whose daughter was born a week after our oldest son, and so we're home with our infant and playing and enjoying, and we get this call, okay, we have our baby, 20 inches long, 6.5 pounds, never said whether it was a boy or girl. So I finally asked, well, is it a boy or girl? And there was this pause, and, well, we don't know. I said, well, what are you talking about? And they said, well, we think it's a girl, but one of the labia is really swollen, and so they're doing some genetic tests. And I said, just one? And they said, yes. Well, it ended up being a cyst. in the labia. But they didn't find out for over a month what the genetic test results were. And of course, they're like, you want to call it the first, child that they had. And I kept saying, I was like, if it was a genetic disorder, it would be bilateral. You wouldn't see, just one side of that being affected. So she had a few plastic surgeries before she was 5 or so to go in there and repair that. But they just weren't sure until they did the genetics.